Brazil's Cruz Institute is warning that health systems in most of the largest cities are close to collapse due to COVID-19 cases. The Rio de Janeiro-based institute says more than 80% of intensive care unit beds are occupied in the capitals of 25 Brazil's 27 states. Brazil has recorded more than 266,000 deaths and 11 million cases since the pandemic began. It has the second highest number of deaths in the world after the United States and the third highest number of confirmed cases.
Well, for more on this, we're being joined by OYEWOLE Tomori, a professor of virology. Thank you so much for joining us. It's always a delight to have you. Very quickly, let's talk about this, what seems to be vaccine nationalism, or what you might want to call vaccine patent hoarding. What do you think about this rift between developing countries and developed countries who hold the patent, and the WHO's intervention, of course?
Yeah, I think it's unfortunate, but we are responsible for our problem. We had all the opportunity to, this is not the first time epidemics are occurring and issues of patents are rising. We never learned from the past errors, and so we have now become beggars. I don't see, I hope the other countries will accept, but I don't see it coming. They're going to stick by their guns, and we'll remain there begging for vaccines, until we learn our lesson and put money into making ourselves ready, rather than what we are doing now as beggars all the time.
Prof, no matter how we look at it, though, the rest of the world cannot be able to live their life as they wish, especially the developed world, if us in Africa and other underdeveloped countries around the world are not vaccinated or don't have access to vaccines, because people will still travel. Don't you think it makes sense for them to realize that this is the situation and they should definitely share the patent?
Sure, I mean, that's the most logical things, but in matters of emergency, people are illogical. Illogicality is not restricted to Africa alone. They are equally illogical in what they are doing, but as far as they are concerned, two things. They are trying to protect themselves. They think that if they vaccinate everybody in their place, they're safe, but they are not. But also, they are also looking at, I think they're looking beyond COVID. If you approve this now and say freedom of patent, waive the patent, what next? The next time is coming, you ask for waiving of patent again. When is it going to end? I mean, these are some of the things they'll be thinking of. And that's why I said it is for us also to get to the point where we can put our money, into research and science, and so that we will not become beggars. I mentioned something about this COVID diplomacy. You don't come to a diplomatic table with nothing. When you come down with your raw material, you get a raw deal. When you come with nothing, you get a raw deal. And that's what is happening to us. We are not offering anything at the discussion table. And so they are taking advantage of us.
To be in, and I wonder exactly what poor countries like Nigeria, or maybe it's better to say developing countries like Nigeria, what can we really bring to the table, and what are the implications of not democratizing this COVID vaccine?
Let me say one important thing. I mean, what we are talking about now is not the thing of today. It's the years of neglect that we are paying for right now. That's what I'm saying. It's a lesson for us to, if we get things right now, we may begin in another 10 years for us, maybe we won't be in the same position. Another epidemic is coming. So for me, let's forget about what is going on now. Let's prepare for the future. For now, we'll have to wait. I can see in maybe by the end of the year, they will have vaccinated all their people. The vaccines will be surplus, and then maybe we'll get our turn then. We're not likely to complete our own vaccination until, if we're lucky, by 2023. Yes. But for now, this is what is going to happen. Nationalism will continue. And we remain at the begging table. I mean, maybe when they finish vaccinating their people and there's surplus around, then they'll give it to us, we beggars. And let's be frank with ourselves. And now it's time for us to begin to plan for the future. That's the point I'm saying. Let our people, our government, all the money we're wasting, all the money we're squandering, we should have been put into research a long time ago. And then we'll be in a better position than we are now.
One of the things that was raised recently by one of our guests, Winnie Byanyima, who is currently the executive director of UNAIDS, she was talking about the pricing of these vaccines, and it looks scandalous and unbelievable that it will be sold to Europe for $2 and then to African countries up to about $10 for one dose. What's your thought?
For me, I mean, it's a seller's market. If I come to you and buy 1 million, and somebody comes and buys 500, you're not going to give me the same price, are you? So let's be frank with ourselves. Those countries are buying millions of doses, and the more you buy, the cheaper it is. Africa is buying 500,000, and you're complaining about it. Sorry, I'm being this thing tonight, but I'm being realistic. If you come to me and you're producing something, you buy 1 million, and then I buy you 10,000. You're not going to give me the same price, are you? So let's be frank with ourselves.
It's common sense. It's common sense as far as Prof is concerned. And I wonder what plans we need to put in place now.
You know, for us, I mean, if Africa gets together, like AU is doing, instead of me individually as a country going to this, and the AU comes together and we are putting out 500 million doses, we get it for cheaper, won't we? But if Nigeria goes alone to India and then we go to Russia, Ghana goes to Russia, everybody goes to different places, you're going to get the price like that. Can we work together as Africa? We don't have this, but we can work together and get this pool together, and then we can get it for cheaper.
Thank you, Prof. All right, thank you very much, Professor OYEWOLE TOMORI, Professor of Virology. Thanks for joining us this evening.